Hello, everyone, and welcome once again to Health Reform Beyond the Basics. Thank you so much for taking the time to join us today. Most of you have been a part of our little project here for years, but those of you who are new, I'm Hallie Cloud, and this is a project of the Center on Budget and Policy Priorities and is designed to provide training and resources that help explain health coverage options available through the marketplace and Medicaid. It is aimed at healthcare assisters, advocates, state and local officials, and others who help people get and keep their health coverage. We at the Center are a policy nonprofit in DC, and as a reminder, this series is intended for those working on the implementation of health reform and is not intended for press purposes. Today's webinar is going to walk through the auto-renewal process in Healthcare.gov, and we'll cover both the process for automatic plan enrollment and the redetermination of eligibility for the premium tax credit and cost sharing reductions. So with that, I'm going to introduce our presenter today. Shelby Gonzalez is a senior policy analyst here at the Center, and she is going to walk you through the Healthcare.gov auto-renewal process. So take it away, Shelby.
Okay, thank you so much, Hallie, and good afternoon, everyone. So throughout this presentation, I'm going to be discussing two processes that Healthcare.gov uses when consumers don't come back to shop during open enrollment, both the redetermination of eligibility for financial help and the auto-enrollment processes. So the first, the redetermination, is the process that Healthcare.gov uses to redetermine eligibility for 2019 advanced premium tax credits and cost sharing reductions when consumers don't take any action during open enrollment, so they do not update their information. The auto-enrollment is a process that Healthcare.gov uses to determine which plan a consumer will be enrolled in for 2019 when a consumer does not take any action to select a plan during open enrollment. The renewal process begins with a bunch of notices, and actually very, very soon the marketplace enrollees are going to get a marketplace open enrollment notice, and we sometimes like to call it the MOEN because it's so fun to say. These include reminders about the importance of updating the application information and comparing plan options so that consumers can get the best deal available. They also detail how the marketplace will redetermine APTCs and CSRs for 2019 if people don't come back and update their eligibility. Importantly, for certain groups where the marketplace cannot redetermine eligibility for APTCs or CSRs, the notice also contains a warning that if they do not come back to Healthcare.gov to update their information, they will be re-enrolled without tax credits or cost sharing reductions. So current marketplace consumers will also get notices from their issuers that will let them know if their plan is being offered again in 2019. And if so, any changes to that plan. The notice will include premium costs for 2019 and will take into account any APTCs an enrollee is currently receiving in 2018, okay? It's important to note that the APTC amount in the notice will not reflect a redetermination of eligibility for APTCs. And I know that concept can be super confusing. Instead, it will only list the APTC amount a person is currently getting, and it will subtract that from the unsubsidized premium costs for the 2019 plan. So this means that the actual premium amount a person would pay for 2019 may be different than what is listed in the issuer notice. People who continue to qualify for APTC in 2019 may have a larger, they may have a smaller amount of their subsidy because of the cost of the benchmark plan in a person's service area fluctuates from year to year, and the subsidy amount reflects the cost of the benchmark plan. This is another reason why it's really important for consumers to return to the marketplace to explore plan options and pricing. We hear that consumers get really confused by this, understandably. So to the extent that you're able to clarify this when you're working with folks, or even in your outreach, it may help people feel more at ease. If the 2018 plan is being discontinued for any particular consumer, the enrollee will receive what we call a discontinuation notice that states that the plan is no longer available. If another plan is available through the same issuer, the notice will have information about the new plan, and that person will be that person will be auto-enrolled into if she doesn't come back to the marketplace to choose a different plan. If the issuer is no longer offering plans in the marketplace, then the person will be matched with another plan with another issuer by the marketplace. But the discontinuation notice from the 2018 issuer will not have any information about that matched plan. It will only have information about the discontinuation of the 2018 plan. When consumers' 2018 plans are discontinued and they're matched to plans provided by the new issuer, they will get notices from the new issuer and from the marketplace. For those of you keeping count, that means the consumer will get 4 notices at this point. They'll have a MOIN notice, they'll get a notice from their current issuer, they'll get a notice from their potential future issuer, and another notice from the marketplace. So that is a lot of information. And it is super understandable that consumers may be confused about all of this information and will need some help in sorting it all out. The marketplace notice is referred to as the cross-issuer notice. It should include the name of the new plan and the issuer that provides it, along with some information about how to view other options and compare them to the cross-issuer match. It also tells consumers how to activate a special enrollment period when consumers are in this situation. It's worth noting that people who are auto-enrolled in a new plan with the same issuer will not get this cross-issuer notice. And it's also important to know that that group that I'm just talking about, the people who have completely different plans within the same issuer, they're also eligible for an SEP. So just keep all of that in mind. I know that's a lot to sort out. So Hallie, I'm not sure if we wanted to take any questions at this point before we get into the redetermination of APTC, or should we just move on?
No, we'll go through this section and then we'll stop at the end of this section before we go into the auto re-enrollment, and
Okay.
we'll take a few questions then and then more at the end. So yeah,
Thanks,
go ahead.
Hallie. Okay, so how will Healthcare.gov auto redetermine APTCs and CSRs? So before open enrollment begins, Healthcare.gov is going to go through a sorting process. It's going to check the latest IRS records available, which for this year will be the 2017 tax year. And based on that information, it will determine the kinds of notices that people will get and sort them into different groups. Those who can be auto-enrolled with APTCs and those who cannot. So anyone who comes back to the marketplace will get their APTC recalculated based on updated information that they provide the marketplace, including an income projection for 2019 and other information like access to employer-sponsored insurance, as well as updated federal poverty line thresholds and benchmark premiums. So I can't emphasize enough what a good idea it is for everyone to return to the marketplace and provide as much up-to-date information as possible to ensure that they will be enrolled with the correct level of financial assistance for which they're eligible. And I'm not talking about just income. Household changes are important, so are new offers of coverage from employers are super important, so that you get the right APTC amount. All right, so let's talk about who is eligible for auto-enrollment with APTCs and CSRs. There are 2 general groups of current enrollees who are eligible to be auto-enrolled with APTCs and CSRs. The standard group and the income-based outreach group. These groups are pretty similar, but they will receive slightly different messages in their marketplace open enrollment notices, the MOIN, that they receive before open enrollment. The standard group is anyone who authorized Healthcare.gov to pull tax information related to income and household size. They have income within the range of PTC eligibility and doesn't fall into one of the special groups that cannot be redetermined. The income-based outreach group is a group who may be at risk of being ineligible for premium tax credits because their most recent income information shows that income is at the margins of APTC eligibility. It will also include people whose 2017 tax income shows a big swing when they compare it to the 2018 projected income. This group will still have an APTC and CSR renewed using the most recent income information, but they are at greater risk of receiving an incorrect amount of subsidies in 2019, should return to the marketplace at any time to update their eligibility information. Then there are the people who won't be able to get advanced premium tax credits in 2019 unless they go back to the marketplace and take some action. So here are 4 groups. The first group includes people who didn't give Healthcare.gov consent to check their tax records. When people first apply for APTCs, they're asked to give Healthcare.gov consent to check their IRS data for 5 years. And most people do say yes, but a small number of people who say no. This is the group that cannot have APTCs redetermined and will need to return to Healthcare.gov to update their information. If they wish to have their eligibility auto redetermined for following years, they can decide and make that decision and give permission for future years when they're updating their application. The second group of people includes people who got advanced premium tax credits in 2017, but the IRS records show that they either didn't file a tax return or they filed a tax return, but they didn't reconcile the premium tax credit that they received in that year. Reconciling premium tax credits is a requirement. If a person receives APTC in 2017, did not file a tax return to reconcile the APTC, then Healthcare.gov will discontinue APTCs for 2019. And some consumers will have reconciled their 2017 tax credits by the time open enrollment begins. And if that is the case, they can go to Healthcare.gov and there's an option to check a box to attest that they indeed have reconciled their premium tax credit. And Healthcare.gov will verify whether or not people actually did file and reconcile their tax credit. The third group are people whose 2017 tax returns show that they have income above 500% of the federal poverty line and therefore appear to no longer qualify for advanced premium tax credits. They won't get an APTC unless they come back and update their application with information that shows they are still eligible. And this is possible. You know, for example, somebody in 2017 was, working more than they usually did, and it was just an unusual year for them. Or maybe their income has, fallen since, but unless they kind of come back to the marketplace and they update their information, the marketplace is just going to go with the information it has for them, and they'll get auto-enrolled into a plan without APTC. A final group of people are those who were auto-renewed for the past 2 years and haven't come back to Healthcare.gov at any point in time within since those enrollments happened, to update eligibility for those years. These are called repeat passives, is what they refer to them in the marketplace. This group will also be auto-enrolled without premium tax credits or cost-sharing reductions for 2019 if they don't come back to Healthcare.gov and update their information. It's important to reiterate that people who fall into any one of these 4 groups and who don't take any action, again, are still going to be auto-enrolled into the same plan or a similar plan, but without advanced premium tax credits for 2019. So now we're going to look at a group of people who will not be renewed in any coverage for 2019 because issuers are not legally allowed to sell a policy to someone they know is enrolled in Medicare. There's a law, there's a provision of a law in the Social Security Act called the anti-duplication provision. And if someone is enrolled in marketplace coverage and is also enrolled in Medicare, then the insurer will terminate that policy at the end of 2018 and cannot renew that policy for 2019. This means that any individual who shares a policy with that person enrolled in Medicare will not have coverage renewed automatically in 2019, even if they continue to be eligible for enrollment otherwise. So no, most issuers will terminate coverage, but they can also cancel the policy once they receive the re-enrollment from the marketplace, or an initial enrollment from the marketplace for a policy that duplicates benefits, okay? So it's all kind of complicated, and it's just another group that you really want to look out for. So people in this situation who are not enrolled in Medicare should return to the marketplace to re-enroll in coverage. A special enrollment period will be available until the 1st of March of 2019 for people to re-enroll in coverage, and coverage will begin retroactively to the start date of January 1. So when Healthcare.gov redetermines eligibility for an enrollee's APTC, it uses the updated federal poverty line threshold. It also has the ability to take into account cost of new benchmark plans, and for income, Healthcare.gov will use the most recent income information that is available to it. There are 3 options for income information that will be used. The first option, it will use the consumer's projection of their 2018 income. If that's not available, it will use income from 2017 tax data. Absent that, as a last resort, Healthcare.gov will use a consumer's projected 2017 income. Whichever one of these 3 options Healthcare.gov uses, it will take the income amount and it will adjust it to 2019. That adjustment factor will be the rate of growth in the federal poverty line for the applicable family size. So how does that work? Let's say that Healthcare.gov is using 2017 income data for a single person. Healthcare.gov is going to take that 2017 income and it's going to adjust it to 2019 by applying a rate of growth in the federal poverty guidelines from 2017 to 2019 for a single individual to that person's 2017 income. So it's adjusted 2019 income would be 1.0219 times the 2017 income, okay? That's a mouthful, but we have a nice little chart here to give you an explanation as to how that would work, okay? Healthcare.gov adjusts income estimates so that the income amount reflects the same percentage of the poverty line for the income data that Healthcare.gov has. Let's walk through 2 examples. First, we're going to look at Katie. Katie was enrolled in 2017, and she came back last year to update her information and re-enrolled in 2018 coverage in the marketplace. So we'll use her most recent income information, her projected 2018 income, as the amount to be adjusted. You just multiply the income that you have by the adjustment factor we discussed on the table in the last slide that we provided in the table. And you get the 2019 adjusted income amount that is the same federal poverty level for the applicable family size. Next, we have Sasha. Her most recent income information that we have is her 2017 tax data. Again, we multiply her income, that's the 2017 tax data, by the adjustment factor. And this factor is a little higher because we're adjusting 2017 income to 2019 income. So it's 2 years as opposed to 1 in the last example. Healthcare.gov also takes into account the new benchmark plan for 2019 when redetermining APTC's amounts, which is really important. So here we have Katie again. She's gonna have her tax credits auto-redetermined for coverage in 2019. In 2018, her income was $17,000. That put her at 141% of the poverty line. And she received an advanced premium tax credit of $3,256 in 2018. This is because her plan was based on a benchmark that costs $3,851, and her expected contribution was 3.5% of her income, or $595. In 2019, her expected contribution is going to be 3.6% of her income. So pretty similar, but for 2019, the cost of the benchmark plan is a little higher. It's $4,236. Because she's being auto-redetermined for APTC in 2019, her income is adjusted to $17,112. Remember, use that rate of growth, still at 141% of the poverty line. The APTC is going to absorb the rest of that cost increase, and her redetermined APTC is going to increase from $3,256 in 2018 to $3,620 in 2019. I'm going to pause for a second and just note that the good news is, I mean, we're explaining all the kind of ins and outs, mostly because you may get lots of questions from people to, try and make sense of what's going on. Again, this is not, like I say this in a lot of the webinars, like you're not expected to make any of these calculations, thank goodness, because if you expected me to, then we would be in trouble. It's really about helping families that might come to you, or individuals that come to you and ask you questions about just why is this such a big difference? Why are there notices indicating this hugely different kind of circumstance? So just important for you all to know. And we're going to pause here, right, Hallie, for some questions?
Yeah, we'll take a few questions now. And again, you can type questions into the Q&A box, and there's a little icon at the bottom of your webinar screen. You can click on that. A little Q&A sort of panel will pop up, and you can type in questions there. Again, we'll be monitoring that box for the duration of the webinar, so you can type questions in whenever you want. But we had a couple questions that we'll go over now. One person had a question about why about the notice, one of the many notices, the first notice, the the MOEN for people who can be auto-enrolled with APTC. And there's sort of there's the regular notice, and then there's the notice, sort of an income specific notice, and they're very similar. But the income specific notice, people who have 2017 tax data that is over 350% of the poverty line are going to get that income specific notice. And why that was at 350 and not at 400%, since the eligibility for the tax credit stops at 400%. And essentially that is because, and Shelby, correct me if I'm leaving anything out, it's because if you're above 350, there's sort of this chance that your income could have gone up above 400%. So they wanted to have a special notice for people to kind of warn that they in particular should return to the marketplace, because they're going to be auto-redetermined with APTC if they don't do anything, and their circumstances might have changed. So that's that.
Yeah, I think that's right. I think it's just a matter of wanting to be cautious. People who are above 400, who end up having the situation where they were getting an APTC all year long, and then they are above 400% of the federal poverty line afterwards. They're going to not be super happy when it comes time for reconciliation. So the point being that they want to give another level of warning to consumers that are in that potential situation.
Yeah. And then someone asked, will the MOEN say if a person can be auto redetermined or if they must update their marketplace application to continue getting APTC? So will it say that clearly in the notice?
Well, you probably can answer this question, but I think the word clearly is always a fun one. I think that we should just pause for a second and remember that, like, consumers are getting a lot of notices and they're confusing. And as much as, there's been a huge effort in trying to make these notices to be a little clearer. And yet it's a struggle, right? And this is something that has been a hard nut to crack across benefit programs, that you're always balancing the need to give legal information that's really important and for a consumer. At the same time, you want to make sure that it's written in a way that consumers are going to be able to absorb it. So the clearly piece, I just want to mention that imagine for a second you're that consumer that has all of those 4 notices that I was like, yikes, that's a lot of confusion. So the short answer to that, and I'm trying to remember exactly, I hope I'm catching the question correctly. The MOEN is going to tell people when they have to go back to the marketplace and take action in order to be redetermined with a premium tax credit. Is that correct, Hallie?
Yeah, I believe that's correct. And I think the important thing too is that they will be auto re-enrolled. They just won't be enrolled with APTC. So the notice will say that, but it won't necessarily be in the clearest language. So,
Correct.
but it will say that. So you won't know. I believe that the notices for people who are not redetermined or who are not eligible to be redetermined for APTC, that the notice won't say why. It will have sort of a variation of reasons why. So they won't necessarily tell them exactly why, but that they just are not eligible for that. I believe the notices are still that way this year.
Yes, it is that way. The MOEN is that there will be a subsequent notice that is sent to consumers under certain conditions. And they will try and be a little bit clearer, but not super clear.
Yeah. And then we'll do a couple more questions now. So there are a few questions about that sort of funny rule with Medicare. And the question, so I'm going to kind of combine a few of these questions, but what type of Medicare would someone be eligible for that would cause this kind of where they legally can't be enrolled in Medicare and a marketplace plan, sort of since there's a lot of different Medicare kind of.
Yeah, but I think that the what really triggers this is once you're enrolled into the first piece, the Medicare Part A.
Yeah. And then we'll do one more question now, and then we'll do the rest at the end. So someone asked, did I hear that, this actually segues quite nicely. So did I hear that a consumer is eligible for an SEP if they're auto-enrolled in a different plan with the same insurer? And the answer is yes, and we're going to go into that in this next section. I think too, one thing to remind people is those, Shelby mentioned it earlier, but the people whose plan is discontinued, but there's another plan with the same insurer, they are not going to get that cross issuer notice that from the marketplace that says you've been matched with this different plan. So that's something to note for that sort of group of people, but they are eligible for an SEP.
Yeah, that's a group that it's going to be kind of confused. Like they're not going to get the clearest communication about their eligibility for an SEP. It's that, I mean, it varies by issuer in terms of what they say in their notice, but it's not going to be as clear. At least last year, it was not clear. It was very much not clear across the board, pretty much.
Yeah.
So for at least most people, what I will say also is there is a difference here, right? Like there are people who are auto re-enrolled into their same plan, and that plan may have been modified quite a bit. That it could have changed. Some things could have changed about that plan, but it's the same plan. So we're not talking about like any kind of tweak happened to your plan and then you're eligible for that. What triggers that SCP eligibility really is that your plan is no longer available to you, and now you're going to be in a different plan. You're going to be auto-enrolled in a different plan. Okay?
Perfect. And I'm actually going to do one more question. Someone had a question about when these notices are going to start coming out.
We hear that the MOEN will be out very soon, and that's as clear as I can say. Probably by the first week of October, if I were a guessing person, I would say.
Perfect. And then again, we'll take the rest of the questions at the end. So why don't you continue on and you can keep typing away your questions. So thanks, everyone.
Thank you. Okay, so now let's discuss auto-enrollment process for 2019 plans sold on healthcare.gov. So if a person, if a person takes no action by December 15th of 2018, they're gonna be enrolled in the same plan as the previous year, of course, if it's available. And Healthcare.gov is going to adjust the advanced premium tax credit based on auto redetermination process that we have already discussed, right? So the issuer will send the consumer a notice with information about premium costs. But if last year's plan is not available, there's kind of a hierarchy of options that Healthcare.gov is going to use for auto enrollment. So the next option is to enroll a consumer in a plan with the same issuer that is similar as possible to the current plan. And in this case, the notice from the issuer will have information about both discontinuance of the person's current plan and information on the new plan, including the premium costs. And that's the notice I was talking about earlier that, you know, who knows if it's going to be super clear about the option for the SEP. Just keep that in mind. If this option is not available either, so let's say the issuer has left the market entirely or is not selling plans in the person's service area any longer, then Healthcare.gov is going to use a third option, a new plan with a different insurer that is as similar as possible to the current plan. So be sure to remind consumers here that they can come back to Healthcare.gov at any time during open enrollment to pick a different plan. And remember that open enrollment is once again shorter this year. So for plans sold on Healthcare.gov, open enrollment ends on December 15th. In years prior to last year and in states with their own state-based marketplaces, open enrollment ended after the auto-enrollment process took place in general. So like last year, this is no longer the case for people on healthcare.gov. So consumers really should be encouraged to come back before December 15th to update their information. So let's take a look at some key things to remember for consumers who can be auto-enrolled in the same plan. So let's note that premiums and benefits and cost sharing may change from 2018 to 2019, and the notice consumers receive should outline what the 2019 premium will be and any changes to the coverage offered under the plan. So consumers will be able to return to healthcare.gov until December 15th to pick a different plan. If they do nothing, they're going to be auto-enrolled in the same plan. So consumers have until December 31st to opt out of the auto-enrollment plan and not have to pay any premium for 2019. Not that you want to wait until December 31st, like sooner the better if that's the option for people. But it's important to know that they have that extra time. Okay, let's go on to the next slide. So what about consumers enrolled into a new plan with the same issuer? So like those enrolled in the same plan, these consumers will get a notice that outlines the premiums, the benefits, and the cost sharing. They will have the same deadline of 2015 to come to healthcare.gov to pick a new plan and the December 31 deadline to cancel the plan that they're scheduled to be auto-enrolled in without having to pay the premiums in 2019 for coverage that they are canceling. So different for this group, though, is that they will be eligible for a special enrollment period due to the fact that the plan they previously had was discontinued. They will, we'll talk about that special enrollment period in just a little bit in more detail. So let's discuss people matched to a plan with a different insurer altogether. So consumers could end up in this situation because both their 2018 plan was discontinued and their insurer is no longer selling plans on Healthcare.gov or in their service area. So for these consumers, they will be matched with a new plan with a different insurer. Consumers in this group will receive a discontinuation notice from their current issuer. They will also get a notice from Healthcare.gov, that cross-issue notice. I always forget exactly what it's called, but it will let them know that they've been matched to a different plan with a different insurer, but they are under no obligation to enroll in this plan. The new insurer is also going to send a notice detailing the premium and the cost sharing and the coverage details for the new plan, along with information about how to pay the first month's premium. It's important to note that people in this situation have to pay their first month's premium to effectuate their coverage. If those enrolled in a new plan or scheduled to enroll in a new plan with a different insurer don't pay their first month's premium, their coverage will not go into effect. Consumers in this group will also be eligible for a special enrollment period due to the fact that last year's plan was discontinued. So auto-enrollment is really a very good thing for most people who want to remain in coverage. And I think about this, and I think about what happened to me last year. And my work, they have an open enrollment season as well. And I was traveling a bunch during the end of last year, and it just slipped by me entirely. And boy, was I really, really glad that auto-enrollment was a thing, right? Because I was auto-enrolled in insurance, and surely enough, I needed it during the year. So I'm very, very, very happy, and I like auto-enrollment. But for those who don't want to be re-enrolled, it's really, really important for the consumers to opt out of that coverage. And we have the screenshots here from Healthcare.gov that show you how that's done. Keep in mind that this is not super intuitive. So for example, a consumer could go into the application and it turns out that now they're eligible for Medicaid. The application flow does not intuitively direct the consumer to this opt-out of being auto-enrolled in coverage. So this is really a place where you can play a huge important role in helping consumers understand the steps they must take to stop that coverage from happening, so that they're not ending up having, both, Medicaid coverage and being auto-enrolled into a plan without a premium tax credit, which, most people who are eligible for Medicaid probably would not want to have to pay a full month's premium without any subsidy, or even with a subsidy that later on they would have to deal with when they're, going through tax time and having to explain to their tax preparer, how this goes. So now let's talk a little bit about special enrollment periods for people whose 2018 plan is discontinued. So for both consumers who are auto-enrolled in a new plan with the same insurer, and consumers who are matched to a new plan with a different insurer, they're going to be eligible for special enrollment period because they lost qualifying health coverage. This special enrollment period is going to allow them to switch plans for up to 60 days before their plan is before their plan is discontinued, as well as 60 days after their plan is discontinued. So for plans that are discontinued at the end of 2018, their termination date is going to be December 31 of 2018. That means they have until March 1st of 2019 to select a new plan. So let's look at an example. We've got Katie again, and she's enrolled in 2018 coverage, but her plan is no longer going to be available in the marketplace in 2019. She receives a discontinuation notice from her insurer informing her that her plan is no longer available, and she receives a cross-issuer notice from the marketplace letting her know that she has been matched with a new plan with a new insurer. She returned to the marketplace after open enrollment has closed, and she has been redetermined for APTC for 2019 using her most recent income information. But she expects to make more money in 2019. She updates her application and her APTC eligibility is recalculated. When she updates her application, she must reselect a plan for 2019. The match plan that she has been auto-enrolled in shows up at the top of her options during the plan selection. She likes the plan and pays the first month's premium, effectuating coverage that will begin on January 1. But what if Katie did not like the plan that she was matched with and wants to pick a different plan? Can she change the plan after open enrollment has ended? The answer is yes. Because the 2018 plan was discontinued, she's eligible for a special enrollment period due to the loss of other coverage. When she updates her application, she must note that she was losing coverage on December 31, 2018, and that will unlock this SEP, or they will activate this SEP. So if she wants to pick a different plan before the new coverage year begins, then she can do that and her plan will begin on January 1. But what if she wants to change plans after January 1, once she's already been auto-enrolled? So let's say that she discovers her doctor is not a network in the plan that she was auto-enrolled in. Can she change her plan at that point? And again, the answer is yes. She is still eligible for an SEP for 60 days after the end of her 2018 plan. So she can use that SEP to change plans. And what if she never effectuates coverage for 2019 and isn't enrolled in a plan come January 1? Can she enroll in coverage? And again, the answer is yes. She can use the SEP to enroll in coverage up to 60 days after the end of her 2018 coverage. And it's also important to note that she will have a gap in coverage in this case, but she will still be able to enroll in 2019 coverage. Finally, we're going to close with a couple of tips, or a few tips, a couple, that relate to auto-enrollment. So first, it's really super important to remind folks to come back to Healthcare.gov to update their information and shop for plans. There are good deals to be had on Healthcare.gov. We don't have the figures for this year, but 80% of consumers on Healthcare.gov in 2018 had plans available for under $75 a month after counting financial assistance. When we do get some updated numbers for this year, we'll send them around. We'll make sure that people have them. Remind people, about the end of open enrollment. Like last year, it comes sooner, December 15th. And then let consumers know that they if they received tax credits in past years, they need to file a tax return and reconcile their APTC. Also important when you're talking to people newly enrolling for 2019, remind them that this is an important part of this whole deal for the following year, like just something that happens, right? And finally, use previous income tax data for 2017 and 2018 to help consumers make a more accurate projection of their income for 2019, especially if their circumstances fluctuate. And this is going to help ensure that consumers get the right amount of financial assistance. In other words, I would really say, just work with families. I think making that accurate kind of assessment of what they really think 2019 is going to look like, and really walking through that kind of making that prediction, it's going to be extremely helpful. And with that, I'm going to turn it over to.
Yeah, and we'll do a few more questions. And if you advance to the next slide, and then the one after that. So these are resources. You guys can't click on any of these links right now, but again, the link to this slide deck is in your chat box, and we'll also send it around after the presentation and post it to our website, so you'll be able to get these links. We'll also add a couple. We had there were a lot of questions sort of about Medicare and PTC eligibility and all of that, so we'll add a couple resources to this about sort of the how that eligibility plays off of each other. But for this presentation, for auto re-enrollment, the important thing to remember is that the situation that we're talking about is you have a family that one of the members of that family is enrolled in Medicare, and that plan cannot auto-enroll that plan again. And so the family will be terminated. And they will receive a notice saying they have been terminated. And so the other members of that family, they won't be eligible to be auto-enrolled. And so they have to actively go back to the marketplace to pick a plan. They can re-enroll in the same plan if it's still available, but they have to actively do that, and they will have a little bit more time to do it. They are eligible for a special enrollment period. Their plan is ending, so they are eligible for a special enrollment period. So they have a little bit more time, but they will get a notice that will sort of, so you'll know which people are affected by this. Okay, now for questions. Actually, could you advance to the next slide?
Sure. And while I'm doing that, I also just want to make one more commercial. I know that I mentioned it several times and we showed the screenshots for how to do this, but I just can't emphasize enough how important it is to, when you're working with somebody who is a current marketplace enrollee, 2018 marketplace enrollee, if they don't want to have that marketplace coverage for 2019 for whatever reason, just like I mentioned with that Medicaid example, it is so super important to help them to take those steps to opt out of the coverage so that they don't find themselves in the situation that they're in the plan that they're going to end up having this huge premium that they're eligible, that they may or may not have an APTC, and it just gets super complicated very quickly. And it's just something that we hear about, just nightmare stories year after year. So just wanted one more commercial on that point.
And relatedly, someone asked a question for a person enrolled in a plan in 2018, and the premium for that plan is taken directly from like a credit card or bank account. When that person is auto-enrolled into the same plan, can the insurer continue to take that premium out of their bank account for 2019 coverage, even if the premium is different?
Yes. Scary.
Yeah. And that includes if they
No
did not get
APTC.
APTC, if that was not redetermined,
Yep.
they will still deduct that full premium.
Yep. That will catch people's attention.
Yeah.
Yeah.
And then for that SEP, for if your 2018 plan has been discontinued, for SEPs, for a loss of coverage, this SEP is sort of nestled within that broader loss of coverage SEP, and there is the sort of relatively newish process where you have to verify eligibility for that SEP. And someone asked sort of a two-part question, will people have to prove eligibility that their plan actually ended to gain access to this SEP, and can you use a discontinuation notice from the insurer to prove eligibility? And the answer to both questions is yes. So I don't know if you have more to add, Shelby, but
Nope, that's right. I think, but the only caveat that I would say is that last year there was some kind of magic day, which was not very magical, that basically there was like one day that of open enrollment that if the person had that there would be an exception to that rule. Basically, if they had taken action during that particular day, then the computer would not know that they would not be able to recognize that they don't have to. This is an individual that doesn't have to verify that they had lost coverage. So I just want to caveat that just be on the lookout for if somebody gets a notice saying that they must provide proof. Then yes, the discontinuation notice that they would get from the issuer is a good piece of proof to provide that. So it's just, it is kind of a belts and suspenders approach, right? Because the vast majority of people, Healthcare.gov should be able to understand and know that this has happened, but there might be some people where they're facing the situation where they actually get a notice saying that they must provide verification.
Yeah. And then, okay, going back to the different notices. So on the application, if someone selects no to that question about giving access to tax information for 5 years, if someone answered no to that, does that mean that they are not auto-enrolled, not eligible for auto-enrollment, or that they are not eligible to be redetermined for APTC?
It means that they're not eligible to be redetermined for APTC, but they will still be auto-enrolled unless they go back and say that they want to opt out of auto-enrollment. So that's no fun. Yes, you have to take both actions.
Yeah. And then, okay, if a consumer canceled their policy during the coverage year, for whatever reason, will they still be auto-enrolled during the next open enrollment period?
I would say that they should not be. However, depending on when they canceled their 2018 coverage and when, I mean, I think they cancel it before the December 15th magic day, which that's when the auto enrollment, you know, or the 26th, is it the 16th or the 15th? Well, basically whenever all of those files get sent over to the issuer, I'd like to say, but I'm not 100% sure, and it's something that we can find out about and get back. I would like to say that as long as it happens before then, you would be in the clear. But you know, these things, like it's not a perfect system. Things happen, you know, once you're on, because, you know, there's a pre-list that happens that is sent to issuers. I mean, it certainly has improved over the years, but you know, it depends. Like if you're doing it in November, it's one thing. If you're doing it on December 15th, I think that I would probably take a next step and make sure that you actively opt out of being auto-enrolled. I just want to say, I guess my bottom line here is like, be very careful. Be very, very careful. And you know, I mean, you might not even have the option, right? Like if it really worked, you've actually canceled your coverage and everybody is aware of it and Healthcare.gov knows, then maybe that option even disappears for you. And that seems, I'm not sure if it does, but that would be a good indicator that you're okay. But if you're like really at the end of the you know, that window, like somewhere on December 15th, and that's when you cancel your 2018 coverage, then I would be, but that's not the way to stop auto enrollment. It would seem weird to decide to cancel your coverage that late during
Yeah,
the year.
and I think too, as a second part to that question, if you know you enrolled in January and then stopped your coverage in March, so your plan ended in March, you shouldn't be in that sort of like batch of
Exactly.
people eligible for auto and re-enrollment. This is really when you're closer to when that process starts happening that you should
Yep,
definitely double check. So.
that's right.
And then we'll do a couple more questions. So during open enrollment, if a consumer goes back to the marketplace and actively enrolls for 2019 coverage, different plan, does that stop the auto enrollment process from happening? Does that sort of put the kibosh on it, or do they have to do like another step to stop themselves from being auto enrolled if they go back in and actively pick a new plan?
It should. But again, like, you know, the world isn't perfect. So I mean, I've heard of people that have said, hey, I selected a plan and then later on was still auto, and it seems like that's a mistake, and it's a mistake that generally when we've seen those kind of cases, they've been able to fix. But, you know, I've seen stranger things, but in general, it's supposed to, the active selection of a plan is supposed to stop the auto enrollment from happening.
And then we'll do one more question that's a little specific. We usually don't do state-specific questions, but this one's sort of important to bring up right now. For people in Virginia with Medicaid expansion starting on the 1st of January, is there going to be sort of a special notice for people in Virginia? Will the auto-enrollment process sort of work like all the other states, or is there going to be something sort of special happening in Virginia?
Well, one thing that's special that will be happening in Virginia is that the MOEN that we talked about, that Marketplace Open Enrollment Notice, there'll be some language that's provided to consumers that kind of fit a specific kind of profiles. So people who look like they could potentially be eligible for Medicaid under the new program, they'll get like a notice saying, hey, you might, now Medicaid has expanded in Virginia, you might now qualify for Medicaid, and then send them to like some kind of link or something like that, right? I believe that there's also plans in place to send a targeted kind of outreach to these individuals as well, to let them know that, that again, Medicaid might be an option. What I will say, it's really, really, really important to all my, and by the way, I'm a Virginian, so all my fellow Virginians, it's super important, and this is actually something important for everybody to just keep in mind, and I kind of talked about it earlier, that when you go through this when you go through the redetermination process, right, that we described earlier, if in none of those circumstances did we ever say that, oh, by the way, now that when we look back at one of those sources of income, like maybe the IRS data source, and now it looks like you're in the Medicaid range and not in the marketplace range, never does one of these scenarios mean that now the eligibility system understands that you should no longer be in the marketplace and makes like a new determination or assessment and sends your information to the state. That's not an automatic thing that happens during this redetermination process. So my friends in Virginia, if you have a lot of consumers who are in the marketplace, income between 100 and 138% of the federal poverty line, and now they're likely going to be eligible for Medicaid, this auto-enrollment process will not result by itself in you getting sent over to Medicaid to be assessed. Like there's activity that needs to happen. You need to you need to file an application, or you need to update your application in Healthcare.gov. That's another avenue. Healthcare.gov will begin understanding that this has changed in Virginia, starting the beginning of open enrollment, before the beginning of open enrollment, I think maybe. So if you update your information, that should happen. But even if it happens and you are sent to Virginia as potentially eligible for Medicaid, right, or eligible for Medicaid, you still have to take the step to cancel, your 2019 coverage. You need to take the step to opt out of 2019 coverage, even in the case that Healthcare.gov has now realized that you're a Medicaid eligible person. Same is true if something else has changed in your life and you're not in Virginia, but now something's changed and now you're going to be eligible for Medicaid. You've got to take that step to stop the 2019 coverage from happening.
And then actually I'm going to have one more question. For if someone makes an active selection after open enrollment closes, so after that December 15th date, they are eligible for an SEP, so they actively go back in, they select a new plan to start on January 1st. Does that cancel the auto-enrolled plan that has already happened?
I would assume not. I would assume that at that point, the issuer, there's a big danger that the issuer would have gotten that I would take extra steps.
Yeah, I think it is, again, supposed to, but that's a
Yes.
real one that you would need to actively check and make sure that the auto-enroll plan has been canceled.
Yeah, it's supposed to.
Yeah.
There is another, swap of information that occurs, but that's one that I would be extremely cautious about.
Perfect. And then again, if your question didn't get answered, if you have follow-up questions, please email myself or Shelby or our general inquiries email box, and we will get answers to you as quickly as we can. And you guys have lots and lots of good questions, so please email us. A couple of words in closing. As a reminder, we're going to be distributing the slide deck and the video recording from today's presentation in an email in the next few days. We're going to post everything to our Health Reform Beyond the Basics website. Right now we have, as many of you know, we've done quite a few webinars already. We had a sort of 4-part series on kind of our core elements of eligibility and enrollment. So we have one on the premium tax credit, one on determining household size and income, one on plan design, and one on plan selection strategies. The first three are all up on the website right now. I will send out an email sort of relinking to all of those. The last webinar, we had a couple technical difficulties, so we'll have that video up as soon as we can. For upcoming webinars, we have 3 scheduled in October. We have one on immigrant eligibility and the enrollment process for health coverage programs. We're presenting that in partnership with the National Immigration Law Center. We will have a date for you guys. We had to move a couple dates on that one. So we will have a new date for that webinar very, very, very soon, but we'll have that in October. We have a webinar on preventing and resolving data matching issues. So if someone needs to prove something on their application about their income or their citizenship or their immigration status, this will be a webinar walking through how you both prevent that from happening in the first place and how you resolve it when it does happen. That will be on Thursday, October 11th at 2 p.m. Eastern, 11 a.m. Pacific. And then we'll have a special guest presentation by the American Association on Health and Disability on best practices when assisting people with disabilities enroll in health coverage. And so that we're really excited about that one. That will be on Thursday, October 18th, also at 2 p.m. Eastern, 11 a.m. Pacific. So you will be able to register for those webinars and any additional webinars on our Beyond the Basics website under upcoming webinars. We'll have those registration links up there soon. Again, all of the materials from our Beyond the Basics project are posted to this site. We have reference charts, guides, frequently asked questions, key facts, additional webinars and slides. If there's something that we haven't done that is missing and you really just like need this new resource, please email us. We're always looking for new ideas for resources to help make your life easier because this is very, very complicated. So if you all need any have any questions or need any assistance going forward, please again email us. We are here to help you. And with that, we're going to bring this webinar to a close. So thank you again so much for joining us, and we will hopefully see you for some of our October webinars. So thank you so much.